Tooth whitening is not bad for your enamel because what you're going to do is, one is you're not going to abuse it. You know, someone who's habitually abusing anything will damage their teeth. But the other thing that people don't understand too about it, if they're concerned about whitening their teeth, hurting their teeth, they sit around all day with acidic foods in their mouth, soda pop, coffee, all these acidic foods that they're habitually drinking. Even a lot of these new waters, flavored waters, have acid in them. So anything that has ascorbic or citric acid in it, vitamin C is acidic. The foods we eat are acidic. So on a day-to-day basis, they're getting more acid from their own saliva sometimes, or foods. Whitening the teeth, if you do it as instructed, is very safe and form, okay? Because if you're brushing with fluoride toothpaste, you're helping to re-enamel and rebuild the tooth structure. So it does not, if you do proper technique and proper home hygiene and proper care, it's non-damage, it doesn't damage the tooth. It can. Tooth whitening can cause tooth sensitivity, well, for several reasons. One is if the patient is abusing the product and not doing it as recommended. When whitening came out, the first whitening agent, the patient was told to wear their whitening tray with the whitening gel all night long in their mouth while it whitened. Well, we know that that is incorrect. The maximum a patient should wear their whitening trays and have whitening gel on their teeth, the maximum is 2 hours a day. After that, you just have inert chemicals sitting on the tooth that cause and create the sensitivity. Okay. Some people just do have hypersensitive teeth. They can get sensitive sooner than 2 hours. They may get sensitive within an hour. So then they can just base and wear their trays more frequently, not 2 or 3 times a day, but they can wear it more frequently, as in do an hour a day every day until they get the whiteness they want, if they're brushing their teeth and taking care of their teeth the way they should. Some people can get away with just whitening their teeth once a month, some once a week, some every other week. So the patient's dependent. Teeth have an intrinsic color. It's either a blue-gray, a yellow, or a white. That's all the basic intrinsic colors of the tooth. And so if they're blue-gray or yellowy, then those patients typically will frequently whiten more to get the desired effect. Somebody who has a base of white in their tooth doesn't have to whiten as often, and they get by with whitening maybe once a week, once every other week to once a month. All right, so we have in-office where you come in, you sit in a chair, we apply some material onto the gum tissue to create a barrier, and then we do up to maybe 4 applications of whitening agent. So you apply it on, rinse it off, see how the patient is doing, if they're sensitive or not. It's used with a light, and that light helps to stimulate the whitening agent. But what we're also doing is we're also using a very controlled prescription strength whitening agent that they can't buy, period. You can't buy over the counter. That's the difference from what people don't understand, is they think they're going to get whitening over the counter. Yes, you are, but you can only get it in a very low grade, which is not prescription strength that you get at the dentist. We have various percentages of whitening agent that's in the gel that we can get that the patient outside over the counter cannot get. So we're using a very concentrated whitening agent in-house or in office. So when they have a take-home, we're going to do a mid-range of strength of a whitening agent, so that the patient doesn't get sensitive and doesn't hurt. When it's in the office, we can control it, and the patient, we understand when the patient's getting sensitive because we're talking to them, and then we can decrease how many sessions we use. The difference is it's more of an immediate white because we're using a lot more higher concentrated whitening agent, and it takes a little bit more time through the in-office. The effects is still the same. It's just how fast the patient wants to become white.